In my line of work, I'm expected to smile a lot. There were times when I had to smile even when I didn't feel like it. A year before I was crowned Miss Connecticut, I learned that I had Crohn's disease. Back then, all I really knew about Crohn's disease was the pain and discomfort it caused me. Now I know a lot more about Crohn's disease. I know how it has affected my body, and I have learned how to cope with it. And every day I am reminded that I'm not alone. Right now you might feel as if you're alone, but you're not. There are about 1 million Americans who are living with the condition known as Crohn's disease. Having a chronic disease is not easy. It's especially hard when you're young, which is when most people find out about it. Maybe I look pretty normal to you and well-adjusted. Well, I am. But when I first found out I had Crohn's disease, I was scared, and I had a lot of questions. You probably have a lot of questions too. This video is going to give you some answers which may surprise you. Today, there are more and better treatments available for Crohn's disease than ever before, and new research promises an even brighter future. We'll hear more about this later, but let's start by answering some of your questions. The first thing that most people want to know is, why me? What caused my disease? It's pretty common for people who are first diagnosed with this disease to think that somehow they brought it on themselves. But one of the things we know for sure about Crohn's disease is that it isn't caused by emotional or psychological factors. Although stress can aggravate any illness, it is not the cause of Crohn's disease. Remember, nothing you did or failed to do caused this disease. So what does cause Crohn's disease? Well, first let's try to understand what this disease is. Crohn's disease can affect any part of your body that you use to digest food. Of course, that includes your mouth. Crohn's disease can affect your esophagus, the tube from your mouth to your stomach, or it may affect the stomach itself. The disease may affect the different parts of the small intestine called the duodenum, jejunum, and ileum. Or Crohn's disease can affect the large intestine, including the colon, or it can affect the last segments of the gastrointestinal tract, the rectum, and anus. Crohn's disease may affect 1, 2, or several parts of the digestive tract, causing them to become irritated or what doctors call inflamed. What actually causes Crohn's disease? Doctors aren't entirely sure, and theories about the disease change. Current information suggests that patients with Crohn's disease have an inborn tendency to develop the disease. About 20 to 30% of people with the disease have a close relative with Crohn's or a relative with a similar disease, such as ulcerative colitis. Crohn's disease itself is then triggered by one or more unknown factors, and the bowel wall becomes inflamed. Many doctors think that Crohn's patients don't have enough of certain immune cells, which normally prevent the bowel wall from becoming inflamed. Normally, these immune cells control inflammation, but in people with Crohn's disease, this system doesn't react properly. As a result, your body may mistakenly perceive normal substances within your digestive tract as harmful. When that happens, your body may overreact defensively, as it does when you have hay fever or other allergies. As part of this overreaction, your body produces cells which keep the inflammation going, so your body may even become allergic to your own inflammation, what doctors call an autoimmune disease. What causes this inflammation in the first place is something that scientists are still trying to figure out. They have many good theories, but right now, no definite answers. Some doctors think that there may be something in the environment that triggers the disease in certain people, something like an infection from a bacteria or virus. But again, no single agent has been found to trigger Crohn's disease in a majority of patients. And although it seems reasonable to think that it was something you ate, no specific food has been found to trigger Crohn's disease. What you eat or don't eat may play a role in the treatment of your disease, but your diet did not cause the problem in the first place. And there is no good evidence that stress or emotional problems can cause this disease. Remember, nothing you did or thought had anything to do with getting Crohn's disease. It just happened, and no one knows exactly why. Fortunately, doctors don't have to know exactly what caused your disease to help you feel better. Treating Crohn's disease is something doctors know a lot about. How your disease will be treated depends a lot on how Crohn's affects you personally, and Crohn's disease affects everyone differently. For example, the disease may affect only one place, such as the ileum or the colon. In other people, the disease may affect several places. For example, the ileum, the colon, and the area around the anus. Sometimes inflammation around the anus produces a chronic sore, what doctors call a perianal fistula. At different times, the disease may be active in one, several, or all of these areas, or the symptoms of your disease may appear to completely go away. Some patients have several flare-ups per year, while some may go years without a flare-up. When your disease is active, how and what you feel will depend on your individual case. You may have some or all of the following symptoms: fever, constipation or diarrhea, abdominal cramps, tenderness in your abdomen, or bleeding when you have a bowel movement. You may have pain or sores around your anus with or without other bowel symptoms. You may also feel less hungry and lose weight. Even when you have gone for some time without a flare-up, it does not mean you are cured. Doctors know that Crohn's disease can come back after weeks, months, or years. So if your symptoms are under control for a long time, your doctor may refer to your disease as being in remission. However, at some point during remission, your disease may flare up again at your own individual sites of involvement. Here are some signs to look for. You may find that you experience a surge in the number of canker sores in your mouth around the time of a flare-up of the Crohn's disease. The same is true of unexplained repeated fevers, an increase in rectal or anal pain, and joint pain and swelling that may feel much like arthritis. Some patients develop painful red sores on the skin, especially the lower legs, a condition doctors called erythema nodosum. Eye redness may be present when Crohn's disease is becoming active. Tell your doctor as soon as you notice any of these signs. If these symptoms are caused by a recurrence of your disease, your doctor will be able to treat you better the sooner he or she knows about it. Fortunately, today there are many new ways to treat your disease and control your symptoms. One method you may have heard about is surgery. So let's talk about this right away. The fact is that there is a strong likelihood that you will eventually undergo surgery. About 70% of patients with Crohn's disease do have surgery at some time. I am one of them. Like me, most patients do very well after surgery. The operation often restores a normal quality of life, and multiple operations are not necessary in most patients. But before surgery is even considered, you will be visiting the doctor so that he or she can decide on the best treatment for you. The first thing that a doctor needs to do is obtain a thorough medical history, and perform a complete physical examination. What your doctor learns will help decide what other tests to order next to help determine the extent and severity of your disease. Often, laboratory tests help in establishing your specific diagnosis as well as the general condition of your health. Some of these tests may require you to give blood or stool samples. You may not need all of these lab tests. You may have had some of them already. Others may have to be repeated in order to track the progress of your treatment. Frequently, lab tests alone aren't enough to determine the extent and severity of your disease. More elaborate tests are usually needed. The best way for your doctor to learn about your particular case of Crohn's disease is with an X-ray. Depending on your case, you may need several X-ray studies. Since Crohn's disease may involve several areas, most patients have barium X-rays of both the upper gastrointestinal tract and small intestine. A part of the large intestine or colon may also be seen on the X-ray films from the upper GI series. These X-rays may take from 1 to 4 hours to complete. The barium shows up on the X-rays. The X-rays outline both the stomach and the small intestine. Sometimes X-rays don't give your doctor the final answer to the diagnosis or extent of your disease. So your doctor may decide to order an endoscopic examination. In endoscopy of the stomach and upper intestine, a flexible scope is passed through the mouth. In colonoscopy, a flexible scope or special lighted tube is passed through the anus, permitting direct examination of the rectum and colon. If your doctor decides you need to undergo endoscopy, you will be made comfortable before and during the procedure by the injection of sedatives. During the endoscopic procedure, you may have a sample or biopsy taken from your intestine. To obtain a biopsy specimen, a small forceps is inserted through the scope. This type of biopsy detects intestinal changes resulting from the Crohn's disease that are not visible to the naked eye. One such change, called a granuloma, is classically found in patients with Crohn's disease. During the biopsy, most patients are unaware when the biopsy is being performed. Some patients report a slight pulling sensation. Keep in mind the fact that because the doctor has ordered a biopsy, it does not mean your doctor thinks you have cancer. During your treatment, there are 2 important points which you should always keep in mind. 1, work closely with your doctor and think of yourselves as a team fighting against your disease. And 2, remember there are many aspects of treatment which you can control directly and which can help minimize the effects of Crohn's disease. The better you take care of yourself, the better you can cope with times when your disease is active. For instance, continue any routine exercise you were doing before your diagnosis, as long as it doesn't make you feel sicker. Ask your doctor if you have questions about new or more intense physical exercise. Your own self-confidence and positive attitude can make a real difference in how well you feel. If you treat your Crohn's disease realistically and without embarrassment, then your family and friends are likely to take the same attitude. You'll find that the differences between your life and everyone else's are pretty small. One area where you can make a real difference is nutrition. Although no one has shown that Crohn's disease is caused by what you eat or don't eat, diet can be an important part of living with your disease, controlling symptoms and supporting the healing process. Your doctor will suggest a diet that works best for you. There are no special rules that apply to everybody. Trial and error are often important, but there are some general guidelines useful for most patients. Your diet may be temporarily restricted when your disease is active, and frequently, diet restrictions become a lifelong form of treatment. The specifics of the diet will depend on your particular case. For example, if your Crohn's disease is mainly affecting the colon and is producing diarrhea, extra fluids and a diet low in fiber will probably be advised. If constipation is a problem, a high-fiber diet is in order, including such items as whole grains, fruits, and vegetables. However, if you are constipated and your disease has caused narrowing and blockage of your gastrointestinal tract, you should stay away from fiber, raw fruits, and vegetables. Sometimes, a test which avoids one food at a time will turn up specific items that cause your symptoms to flare up. But sensitivity to foods is a highly individual matter in Crohn's disease. In any one person, it is impossible to say for sure which foods will trigger symptoms. Many people have trouble digesting milk or other milk products. This problem, called lactose intolerance, is not related to your Crohn's disease, but may be present in addition to your disease. Your doctor can tell you more about this, and he or she may restrict these items from your diet. Diet is especially important for Crohn's disease patients who are still growing. It's crucial that they get enough of the necessary nutrients so that they can grow as normally as possible. If you are having trouble eating your food or cannot properly digest your food, your doctor may want to put you on a special diet, including high-calorie food supplements that you can buy from a pharmacy. When your symptoms are mild, you may only need to drink this supplement between regular meals. These supplements may also help adult patients who have trouble maintaining their weight. If your Crohn's symptoms become moderate to severe, your doctor may decide to use a special diet called an elemental diet, which contains all of the nutrients your body needs. Diets such as these may help relieve and keep you free of symptoms and may work well to induce remissions. Sometimes your doctor may want to get more nutrition into you faster than you can possibly eat or drink by yourself. In children and adolescents, this is often accomplished by feeding through a tube inserted through the nose into the stomach. In other cases, nutrients are put directly into the bloodstream while your entire digestive tract is rested and allowed to heal. This type of diet is called total parenteral nutrition, or TPN. Just as it's important to consult with your doctor about nutrition, it's equally important to work hand in hand with your doctor on all aspects of your treatment. This is especially true with what will probably be the first approach to treatment of your disease, medication. You need to be an active partner in the team effort to treat the disease by understanding about prescribed medicines. Although your doctor is the best judge in determining what medications you should take. Your doctor will carefully consider all of the information obtained from the test we described earlier, and will also take into account your own symptoms and description of the way you feel. The physician will then prescribe an appropriate medication based on the site and severity of the inflammation. It is your doctor's responsibility to stay informed about the latest research into newer treatments for Crohn's disease. Your contribution to the team effort has two main components. One, follow your doctor's medication instructions closely. And two, always report any side effects. Sometimes, if you're feeling quite well or having a reaction to the treatment, you may want to stop taking your medications. But rather than stopping your medication, please let your doctor know how the medication is affecting you, positively or negatively. Then you and your doctor can discuss whether certain changes in your treatment are possible. Remember, your doctor wants to find the right medicine and the proper dosage as much as you want to feel better. The medications available to treat Crohn's disease can be divided into several categories: symptomatic agents, steroids, 5-ASA agents, antibiotics, and immunosuppressives. Since Crohn's disease can cause so many different symptoms, you may receive any or all of these agents at different times. Symptomatic agents are sometimes used to treat the symptoms of Crohn's disease until your doctor brings the inflammation under control with other treatments. Symptomatic drugs may include antispasmodics to reduce cramping and antidiarrheals to reduce diarrhea. If you are having severe cramping and/or diarrhea, ask your physician if these medications would be appropriate for you. Another category of drugs are steroids, agents that actually help to suppress inflammation wherever it occurs in the body. Steroids include prednisone, prednisolone, cortisone, and ACTH. They come in the form of pills, intravenous fluid, injection, and enema. Steroids are frequently prescribed for some cases of Crohn's disease. Although side effects are common, most of the side effects disappear rapidly when steroids are reduced or stopped. Your doctor will discuss side effects with you, and together you will monitor your response to the therapy and any side effects. Many doctors believe that 5-ASA drugs are the best medicines for mild to moderate Crohn's disease. The drugs work directly on the inflammation. The 5-ASA drugs are available as pills, capsules, or an enema and suppository form. Sulfasalazine, one of the most common 5-ASA drugs, has side effects that occur in 10 to 20% of patients, and you need to keep your doctor informed about any side reactions. If you experience nausea, headaches, fever, or allergic skin rashes, be sure to tell your doctor. Some of these side effects may disappear when the dose is decreased or another 5-ASA drug is used in place of sulfasalazine. Researchers have developed several newer 5-ASA agents which are or will soon be available. These agents work at the specific site of involvement, whether it be the small bowel and/or the colon. Occasionally, patients taking the newer 5-ASA agents will show the same type of allergic reaction as occurred with sulfasalazine. Early studies suggest that some of these newer agents may also help to prevent future reoccurrences of your Crohn's disease. Your doctor will prescribe the form of 5-ASA medication that best fits your pattern of disease. There is scientific evidence that some antibiotics may be useful for the treatment of Crohn's disease. Your doctor may prescribe antibiotics for your disease or for infectious complications. Immunosuppressive drugs, such as 6-MP, that modify the immune response, are also effective in treating Crohn's disease. But immunosuppressive drugs are currently reserved for more complicated patients because of uncertain side effects. If you have been on steroid therapy for some time, your doctor may decide to switch you over to immunosuppressive drugs to prevent problems related to long-term steroid use. It's important to remember that the vast majority of patients respond satisfactorily to medical treatment. However, as we said earlier, surgery is an excellent form of therapy for many patients who develop complications or in whom medications are not successful. Usually only a short segment of bowel has to be removed, and although many patients fear they may need an ostomy, wear an external bag, that is unnecessary for the majority of patients. You may feel afraid or discouraged should surgery become necessary, but remember that surgery has restored a normal quality of life to many patients, including myself. It's obvious that getting proper medical care is an important way of helping yourself, and so is having a good attitude about your disease. This can be tough at times, but remember, you're not alone in this. Your family and friends, your doctor, and fellow patients can all be sources of support and understanding to help you cope. Other professionals can also help. Even though you might feel embarrassed or reluctant to call on them, consulting an individual therapist, a family therapist, or a social worker may prove useful if you or family members find that the stress and anxiety of the illness begins to affect the functioning of your normal activities or quality of life. This form of therapy is usually not necessary, but in the right situations, it can help a lot. Many patients and their families find a great deal of help and encouragement from the nationwide network of support groups organized by the Canadian Foundation for Ileitis and Colitis. Despite these means of support, you naturally tend to worry about certain things. For instance, I worried about whether I'd be able to have children. In general, women with Crohn's disease can conceive as easily as other women. If the disease is inactive at the time of conception, a normal pregnancy should not be a problem. If the Crohn's disease is active at the desired time of conception, your physician may ask you to defer pregnancy, since the disease may remain active and even worsen. This decision is made in a partnership between the patient and physician. But remember that most pregnant women with Crohn's disease have normal deliveries and healthy babies. Also, the chance of your child developing Crohn's disease is less than 10%. Men with Crohn's disease may be rendered temporarily infertile as a result of certain medications used to treat the disease. However, fertility returns to normal when the drug is stopped. Once again, you should consult your physician about the timing of any pregnancies. One issue that people with Crohn's disease are especially worried about is cancer. However, cancer shouldn't be a concern, especially for new patients. Cancer does not commonly develop in Crohn's disease. Where cancer does develop, it tends to take decades to appear. Crohn's disease can be painful and difficult to live with, but you can live with it, as thousands of others have. Proper treatment under a doctor's care can relieve the pain and control your symptoms for long periods of time. With your active participation, you can learn to manage your condition as effectively as possible. And we can all be encouraged by the pace of basic research regarding Crohn's disease. Research focusing on the genetic basis of the disease and on the abnormal immune response. The outlook for people with Crohn's disease has never been better or more promising than it is today. You've got good reason to feel hopeful. The keys to living with Crohn's disease are to take responsibility for learning as much as you can about the disease and understanding what affects your particular symptoms. It is important to learn to control your disease rather than letting the disease control you. I know, because I have learned. So can you.